I'm Dr. Mallikarjun, intensive care specialist and anesthetist. I was talking in previous videos also. Today I want to talk about an important topic, uh, that is tablet poisoning. This is tablet poisoning. Now, not only now, most of the days. See, I have been seeing from my house surgeon days onwards, people consume some tablets which are available at the home. For example, sleeping tablets, BP tablets, sugar tablets, and neuro type of medicines which patients use at home, neuro medicines, etc., etc. And particularly the BP tablets are more common, and particularly the sleep tablets, alprazolam, etc., compose, alprazolam, which are used by elderly people. They are consumed by the whoever, maybe children or even adults. They take the medicine in a large quantity and come to us, which are very, very dangerous. Most of the medicines are like this, like diabetes medicines, hypertension medicines, psychiatry medicines, neuromedicines, and number 5, sleep medicine, sleep tablets. So please keep them safe. The tablets should only about 5 to 6 days tablets or 1 week tablet should be available to the patient. The rest of the tablets, please keep it in some almirah locked. Don't make it freely available everywhere in the house, so that anybody, if angry or maybe unhappy, may consume and come to the hospital, which is very dangerous. The treatments are like this. See, once the patient comes after consuming the tablet, we immediately do a stomach wash and then ship the patient to ICU. See, 90%, at least 50% of the patients, they are discharged in 2 to 3 days or 3 to 4 days. But rest of the 50% of patients who take large quantity of BP tablets, etc., they go to complications. Only 50% they go home safely. Rest of the 50% they go to other treatments like dialysis, sometimes dialysis. And maybe the patient may have to be put on ventilator. Sometimes every alternate patient, every third patient, we put the patient on ventilator because the tablets are acting is not able to take breath and all. So this is another complication. And one more thing is further complications with these neuromedicines, etc., are they are depressants, central nervous system depressants. So they go on to, like, the heart becomes very slow with BP tablets. The tablets are not allowing the heartbeat. They may go for you have to put a pacemaker, and the patient is on ventilator, pacemaker, and sometimes to the level of ECMO. So very expensive treatment. In spite of the treatments, sometimes the patient may not survive. So please be cautious about these medicines. I am only trying to caution you because the treatments are very expensive. Only few cases they are discharged very early from the hospital, but most of the patients, 50% of the patients, they land up in complications like renal failure, kidney failure, etc. These are all temporary but very complicated, and all are expensive treatments, like putting the patient on ventilator, putting the dialysis to the patient regularly, and putting the patient on a a defibrillator, or something like defibrillator, something like we put a defibrillator here to increase the heart rate because the heart rate is going down. So these are all the complications. Be cautious, and once again I request, please don't make freely available medicines at home. At least 5 to 6 days, only 1 week tablets, please make them available in a box, and rest of the medicines please keep it in an almirah and get it locked. This is my